Welcome to the Loving Support WIC Peer Counselor Training Program for WIC managers, coordinators, and supervisors. This training has been developed through a cooperative agreement between the USDA Food and Nutrition Service and Every Mother, Inc. It is designed to help state and local WIC agencies implement and sustain successful peer counseling programs that help participants in the Supplemental Nutrition Program for women, infants, and children receive the help they need to reach their breastfeeding goals. The training program for WIC Peer Counseling Program managers, coordinators, and supervisors provides program guidance based on the FNS Loving Support model, research on the evidence behind peer counseling, best practices adopted by state and local WIC agencies across the country, and solutions to address common challenges. State and local agency showcases are also included to highlight successful strategies. The curriculum is divided into 10 major sections. Each section is important for training new managers and for staff in existing programs to assure continued best practices in program management. Each section has an accompanying notebook and handouts. Feedback from participants during in-person training indicated the notebook was an extremely valuable resource. Both the notebook and handouts are accessible on the Maryland WIC SharePoint website. Please print each notebook section and the handouts prior to viewing the webinars so that you can follow along, take notes, and reference handouts as they are discussed. Welcome to Section 2, Peer Counseling, How and Why It Makes a Difference for WIC Families. Research shows that peer counselors influence a breastfeeding initiation, duration, and exclusivity rates in the WIC population. The peer counselor provides a unique relationship with WIC mothers as a trusted friend. This connection complements and reinforces the breastfeeding information and support provided by other WIC staff. You will need the handout entitled The Voice of WIC Moms during this webinar. After viewing the webinar, WIC managers will be able to describe at least 2 ways peer counseling programs can influence breastfeeding initiation, exclusivity, and duration rates in the WIC population. Let's start by examining current data on breastfeeding initiation, duration, and exclusivity rates. Healthy People 2020 has set national health objectives for breastfeeding initiation, duration, and exclusivity because of the important contribution breastfeeding makes to infant health. This 2012 data from the National Immunization Registry shows that great improvements have been made. The percentage of women who initiate breastfeeding at birth is 80%. Based on the CDC breastfeeding report card from 2016, the ever breastfed rate for all mothers in Maryland is 84.8%. And our most recent WIC data shows our rate in Maryland WIC for ever breastfed is 71.8%. As we can also see, many women do not continue breastfeeding long term. This is unfortunate because research shows that the effects of breastfeeding are dose dependent. The longer a mother and child breastfeed, the larger the benefit to both. WIC serves 53% of all infants born in the United States. The breastfeeding initiation rate among WIC mothers has increased steadily from 68.8% in 2009 to 73.1% in 2012. Studies show that WIC participants are more open to breastfeeding, and we should be proud of the work we have done with education and support that is reflected in these increased rates. However, we still have gaps. As you can see on the graph, 73.1% of WIC mothers initiate breastfeeding compared to 90.5% of non-WIC eligible mothers. WIC duration rates are not as high as non-WIC rates. 39.1% at 6 months and 19.3% at 12 months, compared to 68.4% and 41.6% among mothers who are not eligible for WIC. Factors affecting rates include lower education, African American ethnicity, and low income. These are also a representation of populations served by WIC. Research shows that peer support initiatives for women in populations represented in WIC are effective in increasing these rates. We will review the research later in this section. Based on these research findings, peer counseling is now included in many national health policy initiatives. In 2011, the Surgeon General's call to action to support breastfeeding, Dr. Regina Benjamin called for strengthening programs that include peer counseling as an evidence-based strategy for improving breastfeeding rates. Action 3 of the 20 action items calls on organizations to strengthen programs that provide mother-to-mother support and peer counseling. The strategies listed are to create and maintain a sustainable infrastructure for mother-to-mother support groups and for peer counseling programs in hospitals and community healthcare settings, and to establish peer counseling as a core service available to all WIC women. In another national policy document issued by the Office of the Surgeon General, National Prevention Strategy, America's Plan for Better Health and Wellness, there are recommendations for peer support initiatives to help improve breastfeeding rates. The Healthy Eating section of this pivotal national policy document gives these community recommendations. Implement culturally and linguistically appropriate social supports for breastfeeding, such as marketing campaigns and breastfeeding peer support programs. Child obesity initiatives include peer counseling as a key strategy in addressing breastfeeding rates, as breastfeeding reduces the risk of childhood obesity. Section 1.5 of the White House Task Force on Childhood Obesity Report to the President, Solving the Problem of Childhood Obesity Within a Generation, recommends local health departments and community-based organizations working with healthcare providers, insurance companies, and others should develop peer support programs that empower pregnant women and mothers to get the help and support they need. The Institute of Medicine's report, Early Childhood Obesity Prevention Policies, discusses the importance of peer counseling to improve breastfeeding rates among low-income populations. The Centers for Disease Control and Prevention issued recommendations to guide programs in implementing evidence-based interventions to improve breastfeeding rates. The CDC Guide to Strategies to Support Breastfeeding Mothers and Babies provides a section on peer support practice examples to consider, citing that a woman's decision-making process is highly influenced by her social network. We will examine the influence of a mother's social network next. We have discussed our current breastfeeding rates and cited national policy initiatives that highlight peer counseling as a positive strategy to increase these rates. We'll now explore the social learning theory behind the question, why does peer counseling work? Social cognitive behavior theories have long embraced the notion of peer support in affecting behavior change. Psychologist Albert Bandura developed a social learning theory based on a self-efficacy framework that has been widely used in health promotion efforts across multiple disciplines. Self-efficacy has been repeatedly shown to predict health behaviors. Bandura's theory asserts that adults who face new experiences depend on the strength of their self-efficacy. Self-efficacy means that a person feels and believes that they can do something. Modeling or seeing the behavior performed by positive role models is central to self-efficacy. Bandura showed that those who lack self-efficacy can develop it vicariously by observing and interacting with these role models. Bandura's model found that effective role models are similar to the target audience. They demonstrate the behavior and they are rewarded for practicing it. Bandura stated, if the audience identifies with the role model, they can vicariously experience the behavior and the rewards of adoption. Bandura's social learning model has been used by researchers as the framework for studying breastfeeding self-efficacy as well. Breastfeeding self-efficacy is a mother's perception of her ability to breastfeed, including her perception of having enough milk. Perceived low milk supply is a primary reason for supplementation and early weaning at all critical weaning periods. Peer counseling is central to enhancing breastfeeding self-efficacy because it provides that important role model, allowing mothers to vicariously experience the positive rewards of breastfeeding. Peer counselors who have breastfed their children serve as positive role models to promote breastfeeding with new mothers. A woman's social network highly influences her infant feeding decisions. These networks can give encouragement or they can put up obstacles. Women often place a higher value on the advice they receive from their social networks than they do from their own healthcare providers. Research with WIC mothers has shown that a mom is most strongly influenced by her own mother, her trusted friends, and her intuition. The baby's grandmother has a powerful role in a mother's decision about how she will feed her baby. This is especially prevalent in low-income populations and across various ethnic groups. If the grandmother did not breastfeed or lacks information about breastfeeding, she may suggest formula feeding if breastfeeding is not going well. A mother's social network of trusted friends influences her breastfeeding practices, and frequently mothers use their intuition to find solutions that work to solve real or perceived infant feeding problems. New mothers' preferred resource for child rearing advice is other mothers, and perceived social support is a predictor for breastfeeding success. The Cochrane Systematic Review found that peer support is a powerful tool for normalizing breastfeeding, contributing to significant increases in breastfeeding initiation, duration, and exclusivity. And when we can increase these rates, we see more of the positive health outcomes associated with breastfeeding. It's basic human nature to seek out people who share our experiences. Women particularly tend to deal with stress by talking about it, and they often seek out other women who have had similar stresses and experiences. When women face the challenge of being a new parent, especially for the first time, they often feel more vulnerable and look for other women who are new moms or have been new moms recently. Powerful bonds are formed between new moms based on their shared experiences, and these friendships often last a lifetime. While WIC mothers experience a limited number of contact hours with healthcare professionals, they spend many more hours managing breastfeeding on their own. Being able to access a trusted friend can help them gain confidence as a new mother and as a breastfeeding mother. What is a peer? The word peer comes from the Latin word par, which means equal. Webster's dictionary defines a peer as an equal, one belonging to the same societal group, especially based on age, grade, or status. As an equal, WIC peer counselors form a special and unique relationship with other mothers in a way that no other staff member can. A peer is perceived as a trusted friend who is just like them, so they can better imagine how breastfeeding will work with their life. Because women are highly influenced by those they perceive are like them, peer counselors fill the gap in support by serving as a respected role model to build breastfeeding self-efficacy. Federal funding has been allocated to enable WIC agencies to specifically provide this unique source of role modeling. This funding allows WIC agencies to create a culture of breastfeeding support for WIC moms and families. We need to remember that peer counselors do not replace the care of other health professionals. Health professionals provide highly specialized care that enables them to address breastfeeding challenges and high-risk breastfeeding situations. In Maryland WIC, we provide training for WIC staff to have a baseline of breastfeeding knowledge. This means all WIC agency staff can provide a basic level of breastfeeding support and ensures that mothers receive consistent messaging throughout their entire WIC clinic experience. Healthcare professionals, even if they are mothers, cannot replace the unique and special relationship that a peer counselor has with a WIC mom. Peer counselors complement the specialized care of WIC clinic staff and lactation professionals by providing basic breastfeeding information, support, and encouragement within the context of the mother's community and culture. They represent the reality of breastfeeding in their world and show mothers how to fit it into their everyday life. They fill the gap in a mother's social support network by building a trusted relationship and modeling successful breastfeeding so mothers can visualize breastfeeding working for them. They reinforce breastfeeding recommendations by healthcare professionals in a socially and culturally appropriate context. It is truly the power of the peer that is the heart of this unique relationship. Central questions to ask when hiring staff and setting program parameters for your peer counseling program are, will the mother view this person as a peer or an equal? And would she see herself being able to establish a friendship with her? How does peer counseling make a difference for WIC moms? Peer counselors have the time and take the time needed to build a relationship with mothers so they will trust them as an equal. They help mothers feel they can relate to them and feel comfortable sharing their concerns. They serve as role models for mothers who might have few, if any, positive breastfeeding role models. They help mothers prevent and manage common problems, offering basic advice and helping mothers see practical strategies. We'll cover more of this in Section 6, Scope of Practice. They encourage mothers over time with frequent, flexible contacts that meet the mother where she is. And they connect mothers to other sources of support as needed through local agency referral processes. Barriers to breastfeeding, exclusivity, and duration among new mothers are well documented in the research. These can include perceived lack of milk, pain from sore nipples or breasts, difficulties with latch, returning to work or school, lack of education and support, lack of confidence, problems obtaining or using a breast pump, lack of support from family and friends, and wanting someone else to feed the baby. Low-income women are particularly vulnerable to breastfeeding barriers. Having support and information a peer counselor provides may help overcome negative influences of those around the mother who encourage the use of formula. Peer counselors provide targeted support at times mothers are most susceptible to discontinuing breastfeeding, such as during pregnancy as they're forming their infant feeding decisions, and during the early days and weeks after the baby is born. How does peer counseling make a difference for WIC agencies? Peer counselors are a valuable part of the WIC team, referring mothers to WIC and promoting the breastfeeding support available. Peer counselors extend the care of local clinic staff because they have the time that a CPPA does not have during the course of a normal certification appointment to delve more deeply into the barriers and issues that some moms have surrounding breastfeeding. Peer counselors are available to WIC mothers beyond the usual clinic hours and outside the WIC clinic environment. They extend WIC breastfeeding services to the times when mothers need it most. Not all breastfeeding questions or issues occur during clinic hours. How does breastfeeding make a difference for peer counselors? We have heard from WIC peer counselors that their work has transformed their lives. For many peer counselors, it may be their first paid job. They learn valuable job skills and how to work as part of a healthcare team. Many peer counselors have shared that they breastfeed longer because they learn more about the importance of breastfeeding. This might also be because they enjoy the support for breastfeeding within the WIC program. Peer counselors gain a sense of accomplishment and enjoy the reward of making a difference in the lives of other mothers. Does peer counseling affect breastfeeding rates? A systematic review of peer support programs shows that peer counselors have significant impact on breastfeeding initiation, duration, and exclusivity rates. This is especially prevalent among low-income populations served by WIC. 7 randomized control trials reported significantly higher breastfeeding rates with peer counselor interventions versus controls. A study of low-income mothers in Houston, Texas, who were mixed feeders, both breastfeeding and formula feeding, found that mothers who met with a peer counselor within 1 week postpartum were more likely to be breastfeeding exclusively at 4 weeks versus controls, 17% with peer counselors, 10% without. At 6 months, mothers who received peer counseling interventions were significantly more likely to be breastfeeding at 63% versus the control group at 29%. One study observed significantly higher rates of breastfeeding at 4, 8, and 12 weeks postpartum with peer counseling interventions. Scale-up programs offered at least 3 prenatal and postpartum contacts. These programs combined peer counseling with other breastfeeding support initiatives, such as home visits, WIC clinic visits, and hospital support. These programs have a stronger impact on breastfeeding rates. The U.S. Preventive Services Task Force conducted a meta-analysis of 38 randomized control trials of interventions that include peer support that impact breastfeeding initiation, exclusivity, and duration. They concluded that lay support interventions that include peer support significantly increase the rate of any breastfeeding by 22% and exclusive breastfeeding by 65%. The effect of peer counseling interventions is even stronger when combined with other prenatal and postnatal interventions, such as prenatal education, professional staff education, and the Baby Friendly Hospital Initiative. How does peer counseling affect infant health? The CDC Infant Feeding Practices Study 2 found that longer duration rates of breastfeeding are positively associated with improved health outcomes among infants. Studies show improved infant outcomes when a mother participates in a peer counseling intervention, including lower rates of diarrhea disease and jaundice. One study found that infants of mothers who participated in a peer counseling intervention were significantly less likely to be hospitalized during the first 3 and 6 months after birth. How does peer counseling affect different populations of moms? Research shows positive results for teen moms, African American moms, and Hispanic moms. Although adolescent mothers are less likely to initiate and sustain breastfeeding, an intervention of high-intensity contacts from peer counselors with lactation consultant follow-up increased breastfeeding duration rates. Unfortunately, healthcare providers often assume that African American mothers do not intend to breastfeed. African American women are less likely to receive information and support from their providers. WIC peer counselors serving African American mothers believe their assistance as a peer is crucial in filling the gap with these mothers. Research shows that African American women receiving peer counselor support are more likely to initiate breastfeeding compared to those receiving standard care or only lactation consultant support. Low-income Latina women receiving peer support are significantly more likely to initiate breastfeeding compared with controls, 90% versus 77%. A study of predominantly low-income inner-city Latinas in Hartford, Connecticut, showed that women in the peer counseling group were almost 15 times more likely to be breastfeeding exclusively at 3 months versus controls. Please see the Loving Support Through Peer Counseling for WIC Managers training manual for more research studies that provide evidence in support of peer counseling programs, including a showcase study on the Maryland WIC peer counseling program. What do WIC moms say about the help they receive from their peer counselors? The success of peer counseling programs changes rates and changes lives. A WIC participant's breastfeeding experience may change dramatically because a peer counselor was there when they needed her most. Please read the handout entitled The Voice of WIC Moms for stories that WIC moms have shared about their experiences with their peer counselor. Here's one of those stories. The best benefit of the peer counseling program is the follow-up visit and phone calls. You have so many more questions and concerns at home than in the hospital. With the calls from my peer counselor, I was able to ask questions as they came up, and she really made me feel free to call her whenever necessary. I have now completed 1 year of nursing my child. I feel that success is owed to the program because I had someone to help, to answer my questions, and to ease my concerns. This concludes Section 2, Peer Counseling, How and Why It Makes a Difference for WIC Families. Please continue on to Section 3, Program Logistics. Thank you for your participation in Loving Support Peer Counselor Training for WIC managers, coordinators, and supervisors.